Good morning. It's Friday, and this is Feel Good Fridays. I'm Dr. Deb from Medicina del Sol. How y'all doing? Hope you're having a great week and finishing up the week and about to start the weekend. I thought I'd talk about trigger points and how they affect you and how you can treat them on your own, or if you need to call and get some help with that. So what are trigger points? Why do we have them? Where are they? What do they do? Well, trigger points are in just about every muscle in the body, and they have figured out that there are X amount in each muscle that when irritated through overuse, muscle strain, stress, cold, a number of things can trigger these points in the muscle to get really tight and become irritated and then send a message to different parts of the body. So let's say you have some trigger points in the trapezius area, which is very, very common. And a lot of people have their shoulders up, things are tight because of stress, anxiety, what have you. And those hyper irritable spots in the muscle that are known as trigger points will be active and send a signal or a pattern in a certain way into the head to give you a headache. Sometimes it can make you it makes your ears ring, and then we call that tinnitus. Sometimes it'll cause eye strain. It can even trigger sinus reaction, and you think that it's allergies, but actually it's coming from a muscle. It can cause jaw pain, tooth pain, shoulder pain, and so forth. So depending on the muscle, it will travel, the pain will travel to different areas and in a different pattern. And so that's our cue, or my cue, because I study muscle, to know how to treat that properly. And so there's a map, and there are all the trigger points on the map of the body, and how each muscle and the trigger points it has refers. So we look at the referral pattern and we go, that's probably coming from the trapezius muscle or maybe the levator scapula muscle. And so there are different things we can do to reduce that. So if you haven't had a lot of muscle irritation, like what I'm describing, then you may be able to treat this very easily just by applying heat at home, right? You can just massage that area, get some heat on that, get into the jacuzzi, the hot tub, get the jets on it, and it usually helps break things up nicely because you're getting blood flow into that muscle. So with trigger points, you don't necessarily, so let me just back up a little bit. Trigger points are these hyper irritable little spots in the muscle, right? And they cause a bit of an ischemia. And so, it's not functional tissue. It causes muscle fibers to really stick because now you have adhesions in there. And so the muscle isn't contracting and relaxing properly. And when it doesn't function like it should, then it's like a cascade of events that occurs, and you get all these irritants, right? So by applying heat, you bring in new blood flow to that area, you flush it out, and that can help give you a lot of relief and recover. But if that doesn't happen, then what you need to do is a little bit more aggressive, and that's why with massage therapy or myofascial release, which is my life before medicine, and acupuncture I used to do, you get point pressure into those little spots that are super, super painful, and you just apply pressure, what we call an ischemic compression, right? And then you wait until the muscle calms down. And then when you release that pressure, that ischemia now turns into, inviting blood into that area to flush out irritants. So some of the pain irritants that are in there, chemicals, that we produce in our body that, cause inflammation, pain, and so forth. So it just kind of keeps that whole cycle going. So by doing the ischemic compression and reducing it and flushing out that area, you get more relaxation. Now, sometimes that works. The other thing we can do is an acupuncture needle. So with dry needling, right? And using a little needle like this, and let me show you how small it is. It's tiny, tiny, tiny. So if I take it out, you can see how small that is? Yeah, it's like a hair. And this is what I would put into that trigger point, right? So what we do basically is we find that point by locating it with the thumb, and you're like, oh yeah, that's it. And then we clean the area really well with alcohol, and then pop that needle in there, kind of twirl it. What I do is I kind of lift it and move it around a little bit, because what I'm doing is I'm breaking up some of the adhesions in that muscle, right? And that's really important. That's key to healing and reducing them. The other thing we can do is a light current, right? So this is a acupuncture pen, and it's cool because it actually locates the trigger point for me. It also locates the acupuncture points, and there are hundreds of them in the body. But I like to use this for trigger points because I locate it and it'll buzz, then I know I'm on it, and then I apply a light current to that. And so what the needle and the current do, they change the polarity of the tissue. And when you change the polarity, you help to reset that tissue, and then it heals, right? In theory, that's how it works. Another thing we can do is take a needle. So this is for a little bit more aggressive, not as conservative management, but let's say you have really stubborn trigger points. So you may want to have some trigger point injections done, right? And the injections are with some lidocaine, okay? And this is 1%. So what we do is we draw up a little bit of lidocaine into this syringe. And just like I was doing with the dry needling, I'm doing it with a wet needle this time. So I'm gonna pull up the muscle tissue. I'm gonna insert that needle after cleaning the skin really well, right? And I'm gonna insert the needle and just very gently, I'm gonna pull back, make sure that there's no blood in that syringe and I'm not in a vessel. And then I'm gonna just very small amounts of lidocaine are going to be injected in, and as I'm injecting, I'm moving that needle around so I can distribute the lidocaine. But more importantly, the needle itself is breaking up those adhesions in the trigger point, right? So that's cute. That's key. That's huge because you get one, relief with the lidocaine, and two, breaking up adhesions with the needle. So really effective. Sometimes we'll add a tiny little bit of steroid to the lidocaine if you're in tremendous pain and there's a lot of inflammation in that muscle and it's really got a strong referral pattern. We may add just a speck of steroid. Now, I always have to screen my patients because if you have any allergies to that, or if you are diabetic and your blood sugar your glucose levels may be higher than we want them to be, injecting a steroid is not a good idea. So I don't like to use steroids unless I absolutely have to. So I prefer to use lidocaine. Another thing we can use is a substance called Serapin. And Serapin is similar to, well, kind of like lidocaine. It doesn't give you quick effects, but it does help the muscle heal over time. It's from the pitcher plant. It's a distillation from the pitcher plant. And it's really cool stuff because it helps to reduce inflammation, and it helps to reduce some of the pain that you're feeling in that area and help the muscle recover. We also inject it into joints. It's a natural alternative to steroid injections. So there you go. That's another option for you. But those are some medical ways of treating trigger points. What you can do at home is super easy. First, apply heat, as I mentioned, and you can use a dry heat, which is just a heating pad, or you can take a bath towel and soak it in hot water, wring it out, and then wrap it around and hold it there for about 10-15 minutes, and then take it off. And you can cycle that if you do that a few times. That moist heat helps to reduce the trigger points because moist heat versus dry heat penetrates muscle a lot deeper. That's why jacuzzis are so great, because it's a moist heat. Plus you get the jets, pounding on that area and breaks up some of the adhesions and helps the muscle recover. But Yeah. So the other thing you can try is a tennis ball. Tennis balls are great. You can get small little guys like this, or you can get a larger one. And this size is perfect for going right here in the small part of the back or neck, shoulder area where, you know, it's a little more delicate and you have the cervical spine and some of the spinous processes that are there. You know, you can just, you know, position this over the trigger point very nicely. And then once you find that point, you want to go, see, hold it there, go against the wall, lean into it, and you're going to feel that pain. And then when you feel it, you'll know that's it. Stay there until it dissipates. And then you can also do roll up and down the wall to give yourself a little bit of myofascial release too. Super cheap therapy. This one's great for butt, hip, glute, low back, larger areas, right? Same thing. This one does a little bit more with myofascial release. There's some really cool things you can buy online too, where you can, you know, it's a stickier type of ball. So when you anchor and then you start stretching or moving with it, it does a little bit of myofascial release, which is really cool stuff. So yeah, trigger points, they can be active or they can be latent. Active are the points that give you grief, that make you feel awful, that make you think there's something more serious going on and prompts you to get some help. Latent points, well, you may find some of these points when someone starts pressing around, like you get a massage and you're like, oh yeah, oh I feel that. That's probably a latent point. They've found it. It's not actively sending a signal, but it's there, right? I think all of us have that in every muscle. But yeah, so there you have it. It's trigger points that can be treated easily enough. You just need to know how to do it. And if you have any questions, you can always call me at Medicina del Sol, 575-222-1834. You can shoot me a text. You can go on the website, medicinadpc.com, and just send me a message. Ask me some questions. I love answering questions. And if I don't know the answer, I'll look it up and I'll make sure I get you the right answer. So I wish you all the best. Stay nice and loose, move around, stretch that body, and stay hydrated. Muscle is more than 70%, greater than 70% water. So you want to stay hydrated, especially in this heat right now because it's super hot. All right. I'm Dr. Deb from Medicina del Sol. God bless, peace out, and stay well. See you next week.